And good afternoon, everybody. Welcome to the weekly Thursday Town Hall. Today, our topic is Nevada County Status Update. We're going to hear from our panelists where we're at, where we're going, and we have a bunch of your questions already, but if you are here live with us in this chat room, feel free to send your questions and we'll do our best to answer them all. The meeting is also live broadcast on KVMR, and we will also do it on YouTube. Welcome everybody, and let's kick off with the man who gets the most questions in every meeting everywhere, and that would be Dr. Ken Cutler.
Let me unmute. Can you now hear me? Yeah. Okay. Thanks. Thank you, Pascal, for hosting, and thank you, everyone, for tuning in. And I want to just start with an expression of gratitude for all those who have been able to stay home and really adhere to the stay-at-home order. I realize it's been a hardship and difficult, but I am very confident that it has saved lives and saved hospitalization and a lot of heartache as well, despite the difficulties. So let me just start with a quick review. It's really been less than 4 months since COVID-19 was first identified out of China, and it's now impacted over 200 countries with over 2.5 million confirmed cases globally, and over 170,000 deaths globally. In the US, as you know, we're over 750,000 confirmed cases, with over 40,000 deaths from COVID-19. And in California, 35,000 cases as a few days ago, and over 1,300 deaths. More locally in Nevada County, we're at 36 people who have had lab confirmed COVID-19. I know that's down from 38 reported previously, but that's because sometimes when we talk to people, they may be actually residents of another county. And so we adjust there, and thanks for everyone for being patient with those investigations. We have tragically had the one death that we know was from a COVID-19 infection. That being said, I also want to say that we've always believed that the number of laboratory confirmed cases is really an undercount. It does not show us the extent of transmission, the number of people who have likely been infected, because even though testing for COVID is rapidly improving, and we anticipate that will only get better and easier to obtain, we have to acknowledge that it's been difficult. There have been many challenges along the way, and I'm sure Dr. Evans will speak to that as well. And so we know that for every person that we've been able to identify with lab testing, there are multiple people out who have had COVID-19. There have been some studies out of Santa Clara and Los Angeles recently that showed that somewhere between 2 and 4%, up to 5% of people showed antibodies in a blood test, which shows that they were likely exposed and infected. There are some questions about the exact test quality and validity with those antibody tests, but it does tell us that there's been many more cases than have been laboratory confirmed. On the flip side of that, even if we go with a higher percentage of 4 or 5% having been infected, it shows that the vast majority of us are still vulnerable, still susceptible to the virus. And so early on, we've tried to be clear that with the COVID-19, it can infect a lot of people. It can cause severe illness. Many people will have a milder disease with either no symptoms or few symptoms, and so they can be out in the community unintentionally spreading it, not being aware that they're infected with COVID-19. And that's without an effective treatment for the virus, without a vaccine. We have said it's really people socially distancing, keeping physically apart. That is our biggest tool. And as you know, we've all been working under stay-at-home orders in California for over a month now. And it has actually turned out to be our most effective tool. And so we have not seen our healthcare facilities overrun with cases. But I want to caution us that with so many people still being susceptible, with many people having potentially mild illness, that we still have to follow those orders until we get certain things in place, and I'll go over that. So I want to thank everyone for adhering to the stay at home. We know that there's been tremendous cost in terms of income, lost jobs, businesses being down, school having classrooms closed. There's been major disruptions to, just essentially our daily social fabric. But like I said, it has saved lives. We understand that we can't sustain stay at home forever. And so that's why you are starting to see so many different roadmaps and indications of how can we reopen safely, knowing that there are so many people who are still vulnerable. And that's really going to be a balance between protecting people against COVID-19 and a surge, and getting people back to work and back to a more normal life. We know that until we have a vaccine and lots of immunity, 2020 is not going to look like 2019 before COVID. When you look at these roadmaps, these indicators, how can we start to reopen? There are different models out of the American Enterprise Institute, the White House Task Force, Governor Newsom's roadmap to reopening. They share a lot of similar features in terms of we have to have wide-scale testing to be able to know the extent, and also so that we in public health can work with our healthcare partners to identify people, have them isolate at home, identify their close contacts, have them quarantine when we have testing capacity to have the contacts tested as well, so that we can really try to protect against wider spread transmission in the community. We also know that our healthcare workers and first responders and many people working with those with infections need protection, and that those are N95 masks, those are eye protection, gloves, gowns, and there have been disruptions in the supply chains for that. So that has to improve. We have to see a downward trajectory of cases, and we have to have certain safeguards where we can quickly get people isolated or quarantined. So if you look at the 6 criteria or abilities that Governor Newsom and the state health officer laid out, one is that ability to monitor and protect. In Nevada County, in terms of testing, we've actually tested at a slightly higher rate than the state as a whole. But we know that still fewer than about 1% of Californians, 1% of Nevada County residents have been tested. And if you watch the governor and the Secretary of Health and Human Services, Dr. Galley, talk, the state has a testing task force, and they're trying to move from about 15,000 tests per day in California up to 25,000 by the end of this month. And really to have protections, they talked about a number of 60 to 80,000, and that up per day in California. And that just tells you the gap that we need to quickly start to fill with testing capabilities. Another criteria or ability was the ability to prevent infection in people who are more at risk for outcomes. And I just want to assure people that one of the first things we did in Nevada County Public Health was we hired Dr. Glenna Trochet to help us out to reach out to those living in congregate facilities, skilled nursing facilities, assisted living facilities, congregate environments, to go over their plans for protection, for isolating people, for diagnosing people early so that we don't get the spread. And we all know that many skilled nursing facilities throughout California have been impacted, and once it gets into that setting, it can spread really easily to those who are really most vulnerable to severe outcomes and death. And so we're taking pains and working with people to try to prevent that, and then also to be able to respond quickly if and when that does happen. Also, we're working closely with our hospital and healthcare system partners on that third criteria or ability, is that they have the ability to handle a potential surge. And that's where bed capacity, having enough staffing, and having good protection for them comes into play. And that is improving, but we have to get better at that. And the hospitals have worked tremendously hard at increasing their capacity and being ready for that surge. Some of the abilities and criteria are actually out of our local control, such as developing therapeutics, effective treatments, but there are a number of public and private partnerships that are working on medicines that could help those who are sick with COVID-19. The fifth criteria or ability in the governor's roadmap is that businesses, schools, childcare facilities are able to socially distance when they start to come back on board. And many businesses have been talking to us about their plans of how they're going to protect their employees, their customers, how they could maintain socially distance and still carry on their businesses and their jobs. And so we're looking forward to working with the business community. We've already been engaged in some talks as well. We're developing a reopening task force locally to start to evaluate those plans, so that when these other criteria start to be fulfilled, we are ready for that as a community. And finally, the sixth criteria was the ability to reinstitute. We hope not to have to, if we start to reopen, not to have to get stricter again, but we have to be able to watch for cases that are being diagnosed, that are entering the hospital, the number of ICU beds, et cetera, and be willing and able to have the restrictions again that we know have been effective so far. If people look at some modeling, and we all know that modelings have their faults and problems and forecasting difficulties. But if you just look at one called COVID Act Now, you can pull up Nevada County, California specifically, and it does show you that we're staying under the healthcare capacity for surge with the stricter stay at home. If we did nothing, it shows that we'd be rapidly overwhelmed. And then if we had a more relaxed attitude without those safeguards, just within a matter of weeks, we would go above hospital capacity again, which is why we're asking for some patience. We want to reopen. We understand there's a need to, but it has to be done in a incremental way with the safeguards in place. And again, as I finish and get ready for questions, I want to thank everyone. I think our community has responded in really remarkable ways, so that the worst of the COVID projections we have not seen at this point. So with that, I'll stop. Thank you.
Thank you, Dr. Cutler. And let's switch to Dr. Brian Evans from Sierra Nevada Memorial Hospital and see what the situation is locally and how well the hospital is doing.
Thanks, Pascal. I appreciate you hosting this, and thanks to you, Bennett. I think this is a good way to get some information out there. And I was listening closely to Dr. Cutler because all of these things that he just spoke about have a pretty direct impact on Sierra Nevada Memorial Hospital. And it reminds me of when we were looking at COVID-19 on the front end of it and trying to figure out how we might be impacted by cases. And the projections, a month and a half ago were frankly alarming. And if we really had done nothing or just taken kind of a half step to try to prevent COVID-19 from spreading rapidly, I think we could have seen some very difficult times here at the hospital. And we could have been in a situation where it was really difficult to keep up with the demand with our capacity. So I'm really grateful to everybody, Dr. Cutler included, for really getting us into a place where we protected so many people and prevented a lot of unnecessary death. So, and I think everybody that's adhered to these social distancing rules has really played a part in that. So thank you. Our experience up until this point has been that we really only had a handful of inpatients in the hospital with COVID-19. We've had no deaths at the hospital. We've tested a lot of people who've come into the hospital, either in the emergency department or having been admitted to the hospital. So at this point, I think it's somewhere over 300 tests of patients with just a handful of positives so far. So, which is definitely not what we necessarily anticipated on the front end. We have done a lot of planning. We've actually been relatively busy with all the planning work around this pandemic, making sure that we're ready for a surge, really looking at our capacity, looking at our supplies, our PPE supplies and other things, equipment, just to make sure that we know what we're really capable of doing. And then also the labor piece of it, which is challenging in rural communities. So on the PPE, we're doing fine on masks and gloves. Some of these things have been donated to our hospital, actually. We've certainly been working with the county for additional supplies through the Mohawk, which is a repository of stockpiled equipment and supplies, which has come in very handy for us. We've had some community members actually step up and help us, not just with donations, but actually making supplies. We've had a lot of people making cloth masks, which we've been distributing here at the hospital, and that's been great. We actually had a company start to make plastic face shields for us, which are reusable. Typically, those things are disposable items in hospitals. So we actually have a better solution now than we did before all this started, with a local company producing those for us. We've also had a local vodka company make us hand sanitizer, and I believe it's available for purchase now in the community. So that's been very helpful, because all of these things in the supply chain have been challenging as a result of this pandemic, because suddenly every hospital, every healthcare resource in the world has been asking for the same supplies at the same time, and it's really disrupted the supply chain. So there's one example where the community's really helped figure that out for us. We've been keeping close track of our equipment. A lot of people have been asking about ventilators and whether we have enough. And the answer is yes, we have enough for not only our average census, but we have enough for a really significant surge of our capacity at the hospital for ventilators and other things. And one of the things that we've done here at our hospitals, we work with the other 5 Dignity Health hospitals in the Sacramento division. And so we have a daily operational call with all 5 of those hospitals, and we are looking at all the equipment for the region, and all the supplies and all of the human resources that is necessary for a surge situation, and really coming up with surge plans that are just not just for our hospital, but for the whole division, so we can work together. And that gives us a better ability to stretch and deal with these things going forward. So that's actually been one benefit of this, is that we figured out all kinds of ways to work together that we didn't really have established previous to this. On testing, Dr. Cutler was talking about testing, and actually I saw one of the questions was from somebody about whether or not her daughter ought to have an antibody test. So we can probably touch on that. Dr. Cutler may have some thoughts on it. And antibody testing, I think, is going to be an important part of how we're going to know if our population has any sort of protection against infection. As Dr. Cutler mentioned, most of us are probably susceptible at this point in time, even if you look at the higher end estimates of maybe 5% of the population has had COVID-19. Most of us are susceptible, but we really don't know at this point in time, and we need to know going forward in order to figure out how to make decisions about relaxing the social distancing and all that. So a lot of labs now are going to have antibody testing, including the hospital will have antibody testing probably next week. So we'll be able to do tests on folks here. The question is, what's the capacity for that going to be? What's the accuracy of the test? And then what's the significance of a positive test? So, and I think those are, at this point in time, for me, those are unanswered questions. So I don't know exactly how good these tests are. They're being operated under emergency use authorization from the FDA. And so we really want to know how sensitive the test is. And also, if you get a positive, how relevant is that? And if somebody has antibodies to COVID-19, does that mean they're fully protected from infection? We're not totally sure about that, or how long that protection may last. So these are sort of unanswered questions right now. Maybe Dr. Cutler has more insight on that. But I would say that the question was about whether a family member who was ill a couple of months ago before everything really kind of got going, could they have had COVID-19? And I guess it's possible. So that might be somebody who ought to get an antibody test at some point in time. I want to talk a little bit about communication. We've been doing a lot of it, and actually with this pandemic, I think it's been a good opportunity for us to really figure out how are we going to communicate to the general public about what's going on at the hospital. So my view of it is that even after COVID-19 settles down in the future, I still want to make sure that people know what's going on here at Sierra Nevada and that they have the latest information. So we've been doing a lot on the Union newspaper. We've been doing certainly Ubinet. We're doing a lot of Facebook videos and things like that. I've been on KNCO every week and KVMR every Tuesday morning, and actually ABC every Wednesday morning now for the next month. So all of those are efforts to really make sure people know what's going on at the hospital. And I think it's very relevant now, but I want that to continue indefinitely. We talked about the incident command. I do want to talk about finances a little bit, because a lot of people have been asking me this question, and they're seeing in the news that hospitals are struggling financially as a result of COVID-19. And I've talked before to the community, to the Board of Supervisors and others about rural hospitals across the United States are really under a lot of financial pressure. And many of them have closed over the last 10 years because of that. It's just a very difficult, challenging business to be in. We are a not-for-profit hospital, but we still need to actually have an operating margin so we can stay afloat. The good news is Sierra Nevada is in a strong financial position. We have good financial reserves, but the last couple of months with COVID-19, we've really been upside down due to the lower revenue because of having to cancel elective surgeries and actually having a relatively low census in the hospital, which has been, better than being overwhelmed for sure, but it does cause a financial pressure on the hospital. But I think that what will happen is we'll catch up, we'll recover from this, and we'll get back to where we were. I don't think the fundamental financial pressures that all rural hospitals face, including this one, are going to go away anytime soon. And this COVID-19 has just exacerbated that for many hospitals. So, but at this point in time, we're in okay shape. We are talking about a recovery mode. We're talking about elective surgeries and when we might be able to start doing that. And there's a lot of things that need to be considered along the way. We need to make sure that we are tracking our supplies very carefully, all of our labor. We know where we are with our census. We know what's happening in the community with COVID-19 and whether we're on the uptick of a surge of some sort. So we're figuring out all of that right now. We have discussions with our operating room teams and physicians in the community to make sure that we're ready to go when we start doing these elective cases. And I do want to clarify one thing about those. Elective cases are evaluated by physicians and others in our hospital, so that, some cases are considered elective, but really they need to be done before too long because things can get worse over time. And so we're constantly evaluating what's the best thing for the patient under that circumstance. And we are doing cases when they're necessary to do, even if they're not emergency cases. That's about all I have to say. I just really appreciate everybody's support on this, and it's been really inspiring to see the community stepping up to support the hospital and just to do the right thing to try to prevent the spread of COVID-19. And with that, I'll turn it back to Pascal.
Thank you. And we have Stephanie Ortiz, the Dean for the Nevada County campus of Sierra College with us. And Stephanie, could you tell us what's going on or not going on at Sierra College right now and in the foreseeable future?
Learning is taking, a lot is going on, Pascal. Thank you. Let me start by saying thank you for having me on this panel. Appreciate being able to speak with all of you. And, you know, on behalf of Sierra College, thank you to our medical providers, our health providers, first responders, and really the community at large for doing what it can to stay healthy and safe. And that includes our students who might be listening, family members and friends of our students as well. We got out early on this issue. We recognize that Sierra College has an important role to play in our community. And in fact, we're one of the larger organizations in the community in terms of numbers of people on our college campus. So we realized, you know, we have a real responsibility to act in the best interest of our community. And we did this early by limiting access to our campuses and then limiting potential exposure within the community. While physical campuses are closed and they'll continue to be closed into the summer, we will have an online classes occurring this summer, online support for students in terms of student services. Likewise, we've made the decision that for the fall semester, we will largely be providing classes online and be providing student services support online as well. But in saying that, there's a lot that, there's a great amount of student services that are available. We have free tutoring online. We have academic counseling online. Library resources are available. Admissions and records help is available. Financial aid is available. We have our staff ready, willing, and regularly answering students' questions. But we realize that students have real needs, and we certainly acknowledge those needs and are doing everything we can to support them while they advance their educational goals. So for example, students have received loaner laptops. They have received help with internet access, as well as food and gift cards. Our website, at sierracollege.edu, right on the homepage of our website is a really helpful link that is clearly labeled Remote Resources for Students and Employees. And students can click on the student portal and they will then be provided with a wonderful menu of opportunities for them. And that also includes specific supports from the Nevada County campus, our campus here in Grass Valley, and then specific supports for our campus in Truckee, our Tahoe Truckee campus located there. We realize that internet connectivity is a challenge for not just our students, but many of our faculty as well. And we have free Wi-Fi access in a couple of our parking lots on our Nevada County campus. And that Wi-Fi access is for student and faculty use. We've had many people taking advantage of that access. And in fact, on a good news story, we need good news in this day and age. One of our students initially thought that she might have to drop her classes, and students can do that, and without penalty and with fees being waived, by the way. But she worked with counseling and our student support specialist, and it was determined that what she needed was a loaner laptop and was having internet problems. So staff got her help in that regard, and she's going to be completing her semester. And this is an example of a lot of decisions that many of our students are making. Now, on the other hand, for those students who might need to step away this particular semester, they can do that, and please contact our staff for help. So I would also just add that it's important for students to check their Sierra College emails. That is our way of being in touch with them. And there's lots of important reasons for that. We certainly want to respect students' right to privacy. And it's that Sierra College email that enables us to do that. So I'm happy to take questions or pass it along back to Pascal.
Thank you, Stephanie. Thank you so much. And education, well, logical next step would be Scott Lay, our Nevada County Superintendent, and looking very dashing. And so, Scott, what's going on with Nevada County schools?
Well, hi, Pascal. Thanks for having me on. As you know, all campuses, all schools are physically closed right now and will be until the end of the year unless something dramatically changes, which we don't foresee. All schools are using a distance learning model, and that takes various forms depending on the school. And the driving force with that really is internet connectivity. The reason that I'm here in my office today is that I have internet connectivity till about 10:30 at my house, and then I lose it. And I'm unable to connect and have any type of Zoom meeting or anything. And I know that's a lot of our students and faculty have this issue as well. So you'll see it with distance learning. It'll be online, or it could be paper packets with pickups. We have secured Chromebooks and hotspots for our county. That's a huge issue up here. You might have read in the paper, we secured 91 hotspots and Chromebooks for the Twin Ridges Elementary School District. The issue right now is, when are they coming? And so we're pushing the state to get those as soon as possible. We need them now. We don't need them in 2 weeks. So hopefully we'll get those soon. Food distribution has gone very well at all our school sites, so I'm happy about that. We're getting food out to the kids that need it. We understand this is unprecedented in education. It's never happened before, and we hope it never happens again. And we know the impact this has had on parents, on students, on grandparents, and on businesses. And so with that in mind, I really encourage parents or students to reach out to specific schools with issues or concerns that they have regarding their learning. Let us know what those hurdles are. What can we do to mitigate those? What can we do to help? Currently, we have about 10 to 15% of the students in Nevada County that have not picked up any packet, have not communicated with the schools, have kind of disappeared, and we're very concerned about that. So we're reaching out to those students with one-to-one calls. We're also concerned about the mental health of our students and our parents. This is new, this is hard. Students are mainly social creatures. They need their friends, and they're not able to be there with them. So we're pushing out a lot of resources on what students and parents can do in these times to meet those needs. There's also a lot of calls going out from the schools, from counselors, from teachers, checking in with their students to see what's happening. We're refining, as I said, the distance learning models right now. We're looking at what graduation is going to look like, and that mainly is our kindergarten, 8th grade, and high schools. The possibilities of getting together to have some type of graduation is fairly slim, given the models that we've seen. So we're looking at virtual graduations or delayed graduations in the fall to get the students together. There'll be more information coming out about that. Next, we're looking at what does next year look like, and we can't come back to school until the stay-at-home order has been lifted by the governor, and we've been given, and we've worked with our public health department to make sure it's safe. Issues we've got is, will the school year be delayed next year? We're hoping not. How we come back to school in phases, how we're cleaning classrooms, distance, socially appropriate distances in the classrooms. What does recess look like? What does lunch look like? So we're working on all those things. We also have the impending dark clouds of budget cuts, which we know are coming. Given what's happened to the economy, there's no question that schools are going to receive deep budget cuts next year. And we're looking at how does that play out and what we're going to do. So all these things we're working on right now. as we finish this year off, and we look to bring students back for next year. So there's a lot to do, but you can rest assured that I'm meeting with the charter directors and the superintendents several times a week on these topics and discussing and moving forward with that. So that's the update really of where we're at right now, Pascal.
All right, hey, thank you, Scott. And we have also from Nevada County, we have the chair of the board, Heidi Hall, who is with us. And Heidi, little update on what the county is doing?
Yeah, thank you, Pascal. I want to also first thank you for putting on this town hall. I want to thank Dr. Cutler and Dr. Evans and all the other medical and public health personnel who are out there doing a lot of hard work and communicating well and trying to answer a lot of questions that we frankly don't have the answers to yet. So let's acknowledge that. Want to also make sure that the community understands that we're aware of the hardships that we're all under right now. Not only our small businesses, but also families who are trying to homeschool their children while working at home. We know this is a difficult time for everyone. We acknowledge and know that some of the state and federal funding that's supposed to come through to help everyone, especially small businesses and unemployment insurance, that has been slow in coming, that it has been inefficiently distributed, and that some new funds are not even available yet. So I want to just first start by acknowledging all that difficulty. And we're all on this together. So the county is trying to step in and help where we can. So some of the things we're doing that hopefully you were aware of, a few of these at least, is that we're having constant communication with the hospitals, the schools, with small businesses, with our partners, our nonprofit and city and town partners, to make sure that we're getting and distributing the same information and that we're all well informed. We have put on a number of online workshops, including on small businesses, construction industry, the restaurants, where we're pulling together people so you can share with each other what's working and what isn't and what you need. So let me know and let us know if you want to be involved with any of those. I want to remind people that we have constantly updated information, both on our mynevadacounty.com coronavirus webpage, but also at 211 Connecting Point. So if you can't find the information you want on our webpage, call 211 and they will be able to help you as well. What we are trying to do in addition is we are, as you've heard, standing up a recovery reentry task force. We're also looking at putting together a safe summer recreational plan, so that I know there are lots of questions coming up around what's allowed recreationally and what is not, and how do we do that safely. So we'll be coming out in the next week or so with some guidelines about how to do that. And we do have, if you haven't heard, we have also come up, we've begun a Nevada County Relief Fund. So that's in coordination with the Tahoe Truckee Emergency Response Fund, and coordination with a number of other partners, including the Sierra Nevada Memorial Hospital Foundation, the Tahoe Truckee Community Foundation, the Sierra Business Council, the Economic Resource Council, and the Center for Nonprofit Leadership. So the county has put up $100,000 of our county funds, and we're asking other partners, other nonprofits, profitable companies, anyone who can, to help contribute to this fund. And what we want to do is turn it around to help our small businesses and nonprofits in both the western and eastern side of the county who are struggling with their finances right now, struggling to get through. So that's a positive effort. We are constantly, things are changing every day. We're updating our information every day. We welcome your feedback and your questions, but we want you to know that we're here and we're listening, and folks are working around the clock to continue to get you good information. And I'll turn it back to you, Pascal, for questions.
Thank you, Heidi. And the one question that we have that is coming up, that is well, some people consider it an essential activities, other go by the order. And so what about golf? Dr. Cutler, how about those golf courses? Because there are other counties in Southern California that are reopening golf courses, and there is a rather large interest, it would appear, or at least a vocal interest in Nevada County to reopen some of these golf courses. So what are the current guidelines, and might there be a change coming?
Yeah. So thanks, Pascal, for that question. And as you said, we have heard loud and clear that people want to reopen. We want to make sure that that's done safely. I would say that throughout much of California, golf courses remain closed, and throughout most of the Bay Area, throughout much of Southern California. But you are starting to see reopening, and there's been mention of a reopening task force that isn't fully assembled yet. That's going to be looking at business plans, but that doesn't mean we're not constantly talking with our regional partners about the stay-at-home orders, what modifications can safely be done. Jill Blake, the public health director, and I actually spent much of this morning looking at the outdoor recreational component of the stay-at-home orders to see if we could have modifications, not just for golf, but for things like people who play disc golf, or people who want to go out with their family and handle a ball, but not have transmission from people who are outside of a household. So looking at a variety of things. And so I would anticipate that we will have some modifications going forward. I don't have an exact timeline on that. Like I said, we don't want to err and have people coming together too quickly. So we want to make sure that if golf courses in our area open, that they're not sharing equipment, they're not touching the same flag, they're not gathering together in groups from different households, and not having the social distancing that's so important. So if we can get those safeguards in place, I would anticipate you'll see some modifications soon.
Okay, that should give hope to all those that want to know when the next tea time can be. We have a couple questions that deal with antibody testing, and if people should get, if they are available, people who were sick in, say, back in January, and are the tests available, and where can they get them, and what's the use for this? I think you touched briefly on that, but maybe you could repeat it for those who just joined us.
So this is Ken Cutler, the health officer in Nevada County. I would really echo what Dr. Evans has said about what are called serology tests or antibody tests, is that they're coming on board. They're coming on board fairly quickly. There have been some warnings, though, that there are multiple companies that are marketing them without the emergency use authorization from the FDA. So we have to be very careful. We don't really know how accurate they are. And even if they show the presence of antibodies, they're not diagnostic for COVID-19 until we know more. And as Dr. Evans said, very importantly, we're not sure what level of antibody constitutes true protection against COVID-19 and for how long that protection would last. So it's more unanswered questions, even as the tests are coming on board.
And speaking of tests coming available, are there tests available for the first responders, because they are, of course, at a greater risk of exposure?
Yeah, so for the testing, and it feels awful that we've had to prioritize testing in certain ways. We haven't been able to test everybody with symptoms, but at least through the public health lab system and others, healthcare workers and first responders, because their jobs are so important to keep us all healthy and take care of us, and they're on the front line, have always been in that top priority. We've worked closely with some of their occupational health providers to make sure that they're able to collect swabs on healthcare workers and first responders who have symptoms, who have been exposed, et cetera. So, and make those priority specimens with the lab capacity that we do have. So.
And one more question for you, Dr. Cutler. There is a rumor going around that previous flu shots could trigger positive COVID results. Truth or fiction?
boy, I haven't seen that rumor. So
Apparently,
thanks
it's out there.
there are a number of of things out there that we're always looking for more information. I have certainly seen no evidence for that. I know there was some confusion with a lot of the early messaging when COVID-19 was starting in the to appear in the winter time, that we were often saying, please make sure you get your flu shot. That wasn't to protect you against COVID-19. That was because we wanted people protected against the flu so that they're not ending up in the hospital, and so that we don't, it was one of those measures to protect us from overwhelming the hospital system early on. So people were hearing a lot about flu shots and COVID-19 at the same time. Dr. Evans, have you heard anything?
Well, I haven't heard that particular rumor about the flu vaccine causing a false positive for COVID-19 testing. I'd be surprised if that were true, based on the fact that we've done several hundred tests at the hospital and only, like I said before, just a handful of positive tests up to this point. So, and obviously a large percentage of the population is immunized against influenza. So I'd be surprised, but I guess, we're still learning a lot about this particular illness and the testing around it. So, it's just going to take time before we really figure all these things out. But my suspicion is that's probably not the case.
Great, thank you. And of course, there is also, Heidi mentioned the outdoors, the outdoor recreation, and the can we go to the river? Personally, I happen to live pretty close to the river, and I can hear the river right now, which means that it's running fast, and I know it's running cold. So maybe go with what CAL FIRE actually and other agencies have said. It's the river right now is running at over 600 cubic feet per second. So it might be a good idea to actually stay out of the river. The parking lots at state parks are still closed, and that is to avoid that too many people congregating. It is not to prevent anybody from using the trails, but if you use the trails, be aware there are no restrooms, there are no facilities are open. So you have to first, please wear a mask, and second of all, bring your own water. And if you can't find a parking spot, a legal parking spot there, that probably means that there's already too many people, and all the agencies invite you then to go and maybe explore a less popular spot. But again, please be incredibly careful anywhere near the river, because I know the weather is warm, but the water is really ice cold. So I would just like to make that point. And then I got a couple questions regarding if Nevada County is going to do anything regarding the broadband situation because of the both the students and teachers, if the distance learning is going to go on for longer, and in the case of Sierra College, an online fall semester. So are there any initiatives there to either help teachers, students, and also the rest of the population to get better, more reliable connectivity?
I think you're asking.
Yeah, who are you aiming this for, Pascal? Heidi, Stephanie, or myself? I'm not quite sure. We probably all have
I would say Heidi and Stephanie and you are that is directly aimed at the three of you. So who wants to go
Heidi?
first?
I'll start, because there's not a lot I can say at this point. We have deferred to Scott and Stephanie and the schools who have been on the front lines of the need for the broadband for their students. So at the time when more is needed and they come to us, we will to see what we can do.
Let me too, I saw a question earlier about the fall semester, and let me confirm. Largely, most of our classes are able to be taught in the online environment. We recognize that there are a small number of courses that have hours that we need to work on, we are working on that issue of those hours to determine what hours need to be face-to-face. But I can say there's an awful lot of really great innovation going on right now. And so that we're not, regarding those courses that have those hours that need to be face-to-face, it's still in planning. We're still in the planning process. We just don't know yet. We just don't know yet.
Right. And as far as the K-12, I've heard, I have been privy to anything about increasing broadband up here. Our tact has been to try to get the hot spots, and then potentially looking at using them in conjunction with our buses and trying to deliver those out to more rural areas to run the hot spots. But beyond that, I haven't heard anything from the state coming my way of increased broadband work up here.
And nor have I about increasing broadband overall. It's certainly an issue. We recognize it, and we're just trying to do what we can at our own school levels to work with those particular students and their families that need direct help, and making progress there.
And we have a comment in the chat that's saying that Race Communications is still planning on going ahead with basically lighting up the fiber that they are providing by this summer. So that would that is probably for the Highway 174 corridor. So there will be some very happy people there that will actually have true broadband, and then we'll just have to hope that they will expand.
Well, that will certainly help. We appreciate everything they're doing.
And Pascal, we did approve, the board did approve 2 grants very recently for expanding broadband in 2 high priority areas. One of them is up in Truckee and one of them is down here out by the Providence Mine area. So, but none of this is immediate. So, you know, we are looking to the educational institutions and others to let us know if there's a more immediate need, and we would look into what more we could do. But there are at least those 2 projects plus race online for the near future. It's not imminent.
And a question: do you foresee a prolonged sheltering in place for the our vulnerable population, so our most vulnerable seniors?
Well, as we said, it's probably going to be relaxed in an incremental way. And until we really have an effective treatment, and likely until we have an effective vaccine, those who are most susceptible to COVID-19 severe outcomes, so that's people over the age of 65, people with underlying medical conditions such as high blood pressure, heart disease, lung disease, diabetes, kidney disease. We're going to have to be particularly careful about being around other people and being in areas where people might congregate or get too close to each other, because one of the things we've unfortunately learned is that people may look and feel fine and be transmitting, or they may have the virus before a day or 2 before their symptoms start. And so you could be interacting with someone who looks healthy, and yet they could be passing the virus if you get too close, or they don't have a facial covering, that type of thing. So I think, unfortunately, those most vulnerable are going to be the ones staying at home longest. So.
You're on mute, Pascal, but while you're unmuting yourself, I'm going to add one other comment to that, Dr. Cutler, because one of the things we've thought about and talked about a lot is the seniors that are in group living situations, in assisted living, and also skilled nursing. We have 4 skilled nursing facilities that surround the hospital, basically, and we've always thought about that as probably our biggest thing to be concerned with, related to an overwhelming number of patients from this. Fortunately, what we've seen is the folks, the employees at the skilled nursing facilities and everybody there have done an incredibly good job at really protecting those residents. And they've implemented a lot of procedures I know that they've been working with the county on. So I'm grateful to them because so far we've been okay. But it doesn't take much before COVID-19 could get into a skilled nursing facility and really create a lot of problems for that facility, the hospital, and the community. So, and we've seen that in other places.
Yeah, thanks for bringing that up.
Yeah, very important. And so the other question was, are there any type of employment protections in place for people who either have to stay home because the kids are still at home, or who have to care or have pre-existing conditions? So I don't know, Heidi, could you take that question, maybe?
There we go. I was muted. The county has rolled out its protections and plans for its employees. The private companies do what they want. I know that there is unemployment protection through the states, and those programs are been advertised all over the place. And I know that we have the SBC, the Sierra Business Council, is offering advice to folks who are applying for some of these loans and grants and unemployment protection, unemployment payments. I can't speak to the health plans or other coverage that private companies are implementing for their employees.
Thank you. Yeah, I didn't think that there was going to be a magic bullet answer there. But we have in the Q&A portion here, we have some answers that kind of sort of would require some, it's almost medical advice, but I think it's really useful. There, somebody asked us, I am due to receive the second shot of my Shingrix vaccine. Is there any reason not to do it? And another person said that their second shot was canceled and rescheduled for May. Could either of our doctors comment on that?
I don't know about the vaccine question. I'm not sure. So I'm not seeing the second one, but as far as whether or not to delay the vaccine in this situation, I'd probably talk, I would probably talk to an infectious disease doc about that particular one. Ken, do you have any thoughts?
Well, I know that a lot of the healthcare practitioners have changed the way they practice so that we're not bringing people together in waiting rooms. They're doing a lot of the visits remotely to protect their patients. But that means that it's very difficult to do things that you need to be together for, like giving injections for vaccines. So as things evolve, I think you're going to see that some of these measures like vaccines and screenings for mammograms, for pap smears, for other essential preventive services will start to expand. So it's really important that people talk to their healthcare provider, see how their offices are operating, see if they're having special times to bring people in where they're not, at times when they're not evaluating other folks for COVID-19. Some have set up separate entrances, etc. So contact their healthcare provider about that.
Good, great. And we are coming towards the end of the hour. And first of all, I would like to thank everybody for our panelists for being here, all our attendees. Thank you for your questions. Thanks for your interest. And I'd invite anyone of our panelists for your closing thoughts, please. And hear from us live from Sierra Commons, because they have good connectivity. I don't. So that's it for me. And I will pass it on to our panelists for the goodbyes.
I'll just say thank you to everybody for all your support of the hospital and doing everything you're doing to protect the community. Thanks to Scott for the help with the classrooms that we needed for our employees. Really appreciate that. Thanks to the county for everything they're doing. Dr. Cutler, you're doing a great job with that. And, you know, I think we're all in this together, so we'll get through it together.
And I would agree. I mean, that's how I wanted to start with. Thank you to the community. That's how I'd like to end, because it's really people taking personal action, often to the detriment of their income and to their own well-being, to protect the community. And we realize that's been difficult. We're looking for roadmaps and ways to increase what people can do and get back to work, but we want to do it in as safe a possible way as we can, so we don't lose what we've already gained through all of this. So my appreciation and gratitude. Thanks.
Thank you. I guess I'll jump in. I also want to thank the community for their sacrifice and understanding that we are protecting each other and we're protecting our vulnerable by following the advice that our public health officials are giving us. So I want to remind you, please continue to wash your hands, wear your mask when you're going out. Please continue to shelter in place as much as possible until we hear any guidelines for how we are going to be re-entering the economy and how and where we can recreate. I beg of you to please follow the guidelines closely, and kudos to those who have been doing so. Hang in there. We will get through this together. Thank you.
And likewise, I just ditto and underscore what everyone else has said. Thank you for letting me be a part of this today. The employees, faculty, students of CR College, thank you for everything that you all are doing. I am very grateful.
Yeah, and I'd like to echo what everybody else has said, the great communication between our organizations here in Nevada County. And I'd like to thank the parents, the students, the teachers, administrators, custodians, secretaries, everybody involved in school who were given 1 week to completely change the learning style that we'd never done before. And they've done an admirable job on that. And just to remind parents and students, if you have concerns, hurdles, questions, please reach out to your school or your charter and get answers to those. And if you have any novel ideas, I've had people call, leave me many messages or emails. I'm always happy to take those and entertain anything. So thanks so much for the community for doing what you're doing.
Great. And